I hear from is like, what were you thinking? Why did you say we could go to endemic in July?
A much more candid Dr. Deena Hinshaw, as she addresses not reporters or the public, but other doctors in the primary care network. Alberta's Chief Medical Officer of Health does take some responsibility for the fourth wave now overwhelming our hospitals.
Whether or not it was my intention, what was heard at the end of July was COVID's over. We can walk away and ignore it. And that has had repercussions. And I deeply regret how that has played out.
The live stream of the Monday night event made private Tuesday morning after media reported on it. It comes the same day as the Edmonton Zone Medical Staff Association warns hospitals are a month away from acute care system failure, with doctors across the province demanding immediate action as they point to ICU numbers.
That 200 mark for patients in ICU with COVID, which we've never reached before. Our maximum was 180 patients in ICU in our third wave. And so we have a crisis. That's clear. I think everyone's well aware of that.
Alberta Health Services telling CityNews, even when you factor in the extra surge capacity and space made by canceling surgeries, they're still over 90% full in the ICU. The biggest problem, staffing.
You can, fill gyms full of beds, hospital beds, but it doesn't mean you can staff them. So I see a point in the future that we will need to triage.
Many of the numbers and projections Dr. Hinshaw highlighted, exactly what Calgary ER doctor Joe Vipond was warning about when he was accused of promoting fear this summer. One of many wanting to know the plan if ICUs are full.
Manitoba found themselves in a similar situation a few months ago. They ended up shipping people out to other provinces, to Ontario, where they lost a premier because of it. We don't have that same luxury because BC is filled, Saskatchewan is filled. How far are we going to fly these patients and how many are we going to fly?
The health minister's office saying this is no change in messaging for Dr. Hinshaw. She has previously said the move to endemic was too soon. But for some doctors, they see this as an admission of guilt.
I think that deserves an apology to the province and a resignation, because your one job is to protect the health of the public, and unfortunately she has failed.
In Edmonton, Carly Robinson, City News.